It started with a yelp. He was running down to the gate to bark at someone, and he yelped. My husband called to me and I could hear the worry in his voice. I came over and I could see that my dog wasn't using his back legs very well. 15 years as a vet, I knew in an instant what was wrong. I went cold with dread. It took a few seconds for the pet owner and me to get over the denial and realize that this was really happening. My 7-year-old dog's life would never be the same. Huckleberry suddenly developed intervertebral disc disease, a condition where the soft cushioning discs in between the bony vertebrae in the spine degenerate because of genetics. These degenerated discs weaken and they're prone to rupture. When the rupture happens, it can happen slowly and push up on the spinal cord. That can cause chronic pain, even mild neurological dysfunction. Sometimes that rupture happens quickly like that, and the disc hits the spinal cord and a dog can be paralyzed instantly. The worst case scenario is damage to the spinal cord so severe that it causes massive bruising and damage to the blood supply of the spinal cord. This damage can spread all along the spinal cord, essentially killing the healthy cells. At the beginning, it can be difficult to tell the extent of the damage. Intervertebral disc disease, or IVDD, often affects dogs that have long backs and short legs. Dachshunds make up 50 to 70% of cases. Beagles make up 3 to 5%. Huckle is a beagle crossed with a terrier of some sort. He doesn't have a long back or short legs, but I guess he still has the genetics of a beagle. My first job, stay calm and focused. As veterinarians, we typically don't allow ourselves to lose control in tough situations, even when it's our pet, especially when it's our pet and our family is looking to us for guidance. Vets also have years of practice of packing away difficult feelings and putting them aside for when we need to be calm and professional. There'll be a time to cry later. Second step, x-rays of his back and pain control. Acute disc rupture is very painful. X-rays are great for bones, but what you can't see is normal disc material or spinal cord. What you can see sometimes with IVDD is abnormal disc material that's calcified. And instead of it being along the bony vertebrae, it's up above where it should be, where the spinal canal is. And we look at the spaces of the discs. If the space is narrowed compared to the ones beside it, it means there's less disc material there. It's prolapsed. It's gone where it shouldn't. I saw those things in Huckle's x-ray, and that helped to confirm what we were dealing with. But no x-ray can tell me compression on the spinal cord. No diagnostic test can tell me if the partial paralysis will worsen or get better. Many dogs with paralysis from IVDD will get better even without surgery. Some will have lifelong pain. Some will never walk again, surgery or not. Huckle was able to stand and walk with some support, but by the next morning, the weakness in his back end was worse. He could no longer walk. We made the decision then. We wanted the best chance for a full recovery and a life without pain. That best chance was a spinal decompression surgery with a neurosurgeon. The surgery removes any disc material that is pushing up on that spinal cord and compressing it. But not just any vet can perform that surgery. We needed a specialist. So the whole family packed up and took the drive to Vancouver, and we pulled into the Boundary Bay Veterinary Specialty Hospital at around midnight. Overnight, the emergency vets did Huckle's routine pre-surgery workup to make sure he was okay to undergo anesthesia. The plan was for the next morning, he'd go under anesthesia to get a CT scan, and that would tell us where and the extent of spinal cord compression. An MRI gives better results, but it is much more expensive. We spoke on the phone to the neurosurgeon, Dr. Peter Gordon, before the anesthesia. It was his day off, he said, but he was there for Huckle. That's vets. He called us as soon as the scan was done. There was bleeding in the area of the rupture. It was not possible to see from the scan whether that bleeding was continuing, and there was definitely compression of the spinal cord. He might improve without surgery, he might not. When I asked the surgeon, what's the best chance for a full recovery? He said, surgery, but there's no guarantee of a full return to function. And the bad news, he has another 5 sites of degenerated discs that are not prolapsed yet. Accepting the surgery meant accepting thousands of dollars in costs, months of rehabilitation and physiotherapy, no guarantee of success, and a high risk of it happening again. But we wanted that chance for him. The surgery went well, the bleeding was stopped, the disc material was removed from where the spinal cord was. We brought him home a few days later, and I remember hours sitting beside him, massaging his back legs, moving the joints around to make sure that when he did walk again, he would have good mobility. I remember his shaved back, and I remember his tail wagging. He couldn't walk when he first came home, so we carried him outside to pee and supported him with a harness. We got him a special harness that had handles which allowed us to give support to his back end while he learned to use those back legs again. There were hours of physical therapy exercises and strengthening exercises, and he never stopped wagging his tail through the whole thing, through what must have been a very scary time for him. That's dogs for you. He was able to walk with help a couple weeks after the surgery. So we would take him on little walks around our property, but never leaving the property. Eventually we would get down to the gate where the road was, and he so wanted to go out that he would stand there and refuse to go on. We would actually have to carry him back to the house. His whole life was about running in the forest, chasing balls on the beach, and he was my long distance trail running partner. And now he was stuck in a yard learning to walk again. Pretty frustrating. Tail still wagged. The improvement continued for months, and we did lots more rehabilitation to teach his brain, spinal cord, and back legs how to work together again. And we worked for hours, little exercises to build up the strength in the back legs again. Eventually, it was time for him to go out of the yard. So I called the neurosurgeon to give him an update and to ask him, what can't Huckle do? Can he go off leash again in the forest? Can he run around? What if the jumping and running makes it so that he gets another disc rupture? The surgeon replied, life carries risks for us all. Do we stop rollerblading because we might fall? We shouldn't let risk stop us from enjoying life. I say, let him run free to live the life that he loves. I remember his words because I didn't expect that. But I thought it was a pretty damn good way to look at life. Too often we vets give cautious advice, looking too much to the risks rather than the joy and the enjoyment that our patients and their families deserve. So I let my dog run and play with his friends. No more chasing the ball though. I drew the line at that. He didn't recover 100% neurological function. He still has a goofy hind end sway, but he can walk and run pretty well, and he's happy. But even 5 years later, he'll be off in the forest chasing a rabbit or something, and he'll yelp. And my heart will stop for a second, thinking that it's happening again every single time. But he keeps on running, and we enjoy the gift that we've been given every day for the past 5 years. My lesson from this, run in the forest every day, even if you have a goofy hind end and a back that might give out at any moment, and wag your tail at adversity. I actually have an update on the treatment for intervertebral disc disease. Texas A&M vets actually just released the results of a study, March 2025. They are studying an enzyme they inject into the area where the abnormal disc material has ruptured and pushing up on the spinal cord. This enzyme eats away at that abnormal disc material. They found that the dogs given this injection recovered as well as those that had surgery. That is huge. It means that it's going to change the way we treat these guys in the future, that more dogs will have access to treatment, not just surgery, which can be quite expensive. But even though the gold standard at this point is decompression surgery, many dogs recover very well without surgery. Let me know in the comments what your dog or cat has taught you about life. Hit the subscribe, and thanks for letting me talk your ear off about my dog. Watch this video next.